ai whanau ta malupe manoa Fui kahi e na moa ta funga mahina Hau hau to a oe mai ko tapinga Hau hau to a oe mai ko tapinga Te ki e hau kati o tuku alofa Toki a e manu hau he si utaka Ani taunua e matangi tonga Kalanoa hotoka kalata ulema Kalanoa hotoka kalata ulema Roto uka e na uai kalufasi Ote si a merka o sa ti paluki Kakai hoto lolo he a peto kimiliki He whetau ai tongi aki hanotahi Vai utu kakau si ile atamatangi mai Lue a manapi o tulalo he fumaka Fesi loto o mamoi e si o elenoa Taulanga e pui mamau, takuto e ea Makatau mai e whakanuka tuke anga Vete anga ia e tako tatala Pui maha fufongia i moana o liukama Kotokolo si mawhasia veka ke fua Funga mana mo ui kai ana manu fitaa Sa ai laione oi sila pelua Sa ai laione oi sila pelua Roto uka e na uai kalufasi Ote si a merka o sa ti paluki Kakai hoto lolo he a peto kimiliki He whetau ai tongi aki hanotahi
Welcome to our Pacific Islanders broadcast. Today is August 25th, 2021. We'd like to welcome everyone to share all the great information from our community and also from the King County Public Health. So I'm so glad that we have all the staff, from the King County to help us, share all the resourceful information. And not only that, but we have our Tongan radio manager, from New Zealand. He's also joining us. And we will hear from him also. He is going to share how the COVID, is affecting New Zealand right now. But in the meantime, we will be start asking questions to Christina Predict, who has a master's in public health and epidemiology, and is a public health information officer for Public Health Seattle and King County, and they are focused on COVID-19. Also, I'd like to welcome Carmen Olivera. She's the program manager in the department, and Brenda Gallick. She's one of our islander from the islands of Marshall Islands. And we're happy to welcome everybody to our Pacific Islanders broadcast and abroad. But before we continue on, we would like to take this opportunity and also shortly we'll be having some other guests like Dr. Sela Panapasa. She's a Pacific Islander research scientist at University of Michigan. Native Hawaiians is half Tongan, half Fijian, and half Indian. So we're so fortunate to have you all to take your time out of your busy schedule to share the resourceful information with our community. So my first question here, I would like to ask Christina Bredig. COVID-19 rates were dropping and now they're increasing again. Can you share what is going on in King County? And I would just say a little one version in Tongan. Na ito foki ai fika ko ia na alkilalo ai COVID-19 rate. Pa ko ni kuto e alu hakeki olunga e King County ayak maunofoi. COVID-19 rates were dropping and now they're increasing again. Can you share what is going on right now with the King County? Christina Bredig, thank you.
Hi, thank you so much, Sylvia, and thank you for having us. We are seeing a really difficult and unfortunate trend in King County that's actually being seen all over the United States. And since June 28th, the cases have been on an upward trend. At the end of June, you were seeing maybe about 55 new cases daily was the average in King County. And last week, that number was 593. So the good news is that this was a small increase this week. It was a 2% increase. And in prior weeks, it was a 15 to 20% increase. So the increase in cases is slowing down, but it's still something we're really concerned about. And this is largely due to the Delta variant, as well as people having close contact with others, not masking in public places. There's a lot of things that are contributing to this, but that's what we're seeing in King County right now.
Thank you so much, Christina. I know that there is a lot of things that are asking by the people in the community, and I'm sure it's happening in different parts of the country. Can you share why variants happen and how the Delta variant is different from the COVID-19? Thank you.
Yeah, so the Delta variant, we know that it is more contagious, and studies are showing that it can also show more severe symptoms in people who are unvaccinated. So how variants happen is when you're infected with a virus, that virus replicates inside the body. And then from there, not only does the virus make you sick, it can also spread to other people. And every time that virus replicates and makes more of itself, there's a chance that it'll change just a little bit. And this is where variants come from. Those are changes that happen as the virus replicates itself. And these mutations help the virus to survive better. So the more the virus passes from person to person and has those chances to replicate, the more variants we will see. So that's why it's really important to take measures to help stop the spread of COVID-19. With the Delta variant is more infectious, but what we're seeing with people who are vaccinated, they have significantly more protection. In King County, people who are not fully vaccinated are 10 times more likely to test positive for COVID-19. They're 15 times more likely to be hospitalized and 12 times more likely to die. So COVID-19 or the COVID-19 vaccine provides significant protection against these variants, and it helps stop the spread in the community.
Thank you so much, Christina, for the very relevant and information that you make us all aware of, and the that is the most updated information that you're sharing today. We are also joining with Dr. Sela Panapasa, and I know that she has some question because that's what her field. She's a Pacific Islander research scientist at the University of Michigan. Also the Native Hawaiian and Pacific Islander. She served 80 years in the Census Bureau, and now she's working toward with the health data. Dr. Stella Panapasa, welcome to our Pacific Islanders podcast. I know that you have a question that you may even, or something to share. Can you go ahead, Stella? Thank you.
Actually, thank you. Malo lele Yahweh. Good evening, everyone, from beautiful Ann Arbor, Michigan. I would like to thank Sylvia and her group for extending the invitation to your program. First of all, so congratulations on your program and to your distinguished panel. I think my question, and I'm hoping perhaps Christina can help me, if you can provide, and I would like to, my question is really directed at new statistics, new data and results that was released today. If you can grant me a shared capability, I'd like to share the document with everyone. Can I get share? Okay, I would like to share the screen. Let me see. Okay. Here's the, can you see this? These are the, can you see this report, the screen that reads Washington coronavirus vaccination progress?
I am not.
You don't see anything? Oh, well, let me try again. Why is this? This is the screen. Oh. No, that's the screen I'd like to share.
A screen, to show. I would like to ask Christina, Christina, how will masking help while Stella is trying to put up, the next screen? Thank you.
Let me, I'm sorry.
To ask to take this opportunity to ask another question to Christina. Predict while you're trying to prepare it. Is that okay, Stella? think Zella is not hearing me, but
Yes, please go ahead.
yeah. Okay, Christina, I know that you have answered, some of the questions I've been asking. Now, my next question, how will the masking help? Christina, predict.
Yeah, this is a great question. So, I think it's been hard for a lot of people in Washington state just with the changing recommendations and realizing that that can sometimes be frustrating because our mask mandate lifted the end of June when overall in the county it was 70% vaccination rate. And I think a lot of people were really excited. And now Washington state has put back on a mandate to always wear masks inside. And this is part of what we're calling layered protection. So the vaccines protect very, very well, but they don't protect 100%. Masks work really, really well at stopping the spread, but not 100%. And social distancing works really well, but not 100%. So doing multiple things really helps provide that layered protection to really help stop the spread of COVID-19 and stopping yourself and other people who are vulnerable from getting COVID-19. So as of now in Washington state, masks are mandated in all indoor public places. Outside where you have good ventilation, it's recommended that you socially distance from people, but masks are not necessary. And if you're inside with a private group, for example, you have a small group of friends over for a luncheon and everybody's vaccinated, you are likely safe not to be wearing masks. But extra protection never hurts. And we just encourage everybody to mask up. It's a really easy way in addition to getting vaccinated and practicing good social distancing measures.
Thank you so much, Christina. Now, I think Sela is ready to go ahead and share her screen.
I am. Thank you. So this is my question is going to be directed at this result. Christina, I'm not sure if you're familiar with this report that just came out that was released today, and it's based on it basically reports on vaccination, the progress of vaccination nationwide.
Okay.
This information, for example, here we go. You can have all 50 states is reported, and I basically clicked into Washington. And that's that's what you see in front of you. And according to this report, of the 5 million people in the state of Washington, 66% of the state's population has received at least one dosage. And overall, 59% of the total population has been fully vaccinated. Now, and goes on and provides this breakdown, and it's for the time period of February 21st to August 24th, which is the most current stats that's publicly available. And I'm just going to scroll down to the breakdown by race and ethnicity. And according to the results, here we go for NHPI. What we find is that, or what they are reporting, is that of the 35,443 people NHPI, 71% of the population has at least one dosage, and that 30,812, or 62% of the population, has been fully vaccinated. Now, my question is open to you and the community leaders in the state, the NHPI community leaders. As I question the reliability, the accuracy, and credibility of these results. Unfortunately, the report does not provide information on how these numbers were calculated. They do indicate that the information, the data was derived from public health departments at the state level. And it just because when I engage with community leaders and stakeholders across the country, including Washington, I'm getting the opposite response. There's issues around misclassification by race. It's unclear what the denominator is for calculating these rates. And there's issues around, undocumented language proficiency, the extent to which outreach and community education and engagement is, and what's interesting in looking across this country, across the different states, American Indian and Alaska Natives, Native Hawaiian and Pacific Islanders have the highest success rate for vaccination. And these are also the two smallest, numerically smallest population. So my concern, I was hoping perhaps you could help illuminate or help provide some insight into how these numbers were derived. And secondly, share my concern where this misrepresentation and inaccurate information is a gross a misrepresentation of the reality within these communities. And at a time when the country is investing monies and resources to address the inequities of vaccination and responses and treatment to as a result of COVID-19, I feel that this type of information puts Native Hawaiian and Pacific Islanders in a very positive light, if I may, that they would continue to be ignored. And so I just wanted to share that information with you. And then they go on into looking at differences by sex and gender, as well as age. But it's all aggregate information. But this is the result that concerns me the most. And I'm hoping that you and the community leaders there in Washington could perhaps help me understand whether these, and get your reaction to these numbers, these results. Because I already saw a press release raving about the success rate of Micronesians in Oregon. And in the state of California, Native Hawaiian Pacific Islanders are looking at close to 100% complete full vaccination. And I'm not convinced that that is accurate.
Yeah, thank you, Sila, so much for bringing this up. And I can tell you a few things, but I think I really want to highlight your concern that this could be misinterpreted in a way that thinks that maybe Native Hawaiian Pacific Islander communities don't need as many resources to increase vaccine equity. And we can talk about a few things that are happening in King County. Native Hawaiian Pacific Islanders continue to be a community of focus, including with things such as the show that Sylvia does, and Brenda and Carmen may be able to speak to that as well. Looking at the data, so I put in a link in the chat, and that is King County's data tables. So if that's interesting to you, for our county, you can see updated information. And there was recently a milestone of 70% reached across reported ethnicities in Washington state, in King County. So that is a milestone that we're definitely celebrating, because earlier this year, when 70% were vaccinated, we knew that some community groups definitely were under vaccinated. So those became communities of priority. A couple things about the data. that I think are relevant for people to know and that you hit on as well. One, this is based on census data. So it's been interesting as well because the census data has changed since vaccines began. And we even know there were some when the last census was done, there were some things that are not typical for censuses in other years. So there was a point early on when for King County, it would show that greater than 100% of Native Hawaiian Pacific Islanders had been vaccinated. And that's because it was based on very old census data. And when that census data was updated, you were able to see that shift to more realistic numbers. So that's one thing that we base it on for the denominator is the census data. And it's the best data we have to know who lives in King County, but it is imperfect data. And the other thing you talked about is these are percentages, not rates. So as you hit on, I believe there's right around 1,500 people in King County who identify, or 15,000 who identify as Native Hawaiian Pacific Islander. So when one person gets vaccinated or 5 people are vaccinated, that percentage will go up a lot more than you would see with the Hispanic community or the white community. So we like to use rates. So talk about vaccines per 100,000.
And standardized rates. I mean, age adjusted or standardized rates. No, you are correct.
Yeah.
It was based on a proportion of the population, but even so, and if you said it, your denominator is derived from the 2020 census, or the estimates of the American Community Survey.
Yeah, so you can see at our data dashboards, which are at kingcounty.gov/COVID, you can see different rates as well as it'll know the census data and how those numbers are come across. And then we also have some equity dashboards where you can compare different groups. But for King County, we can't speak for all of Washington or what's happening in other communities. But in King County, especially in South King County, we know that due to different barriers, a lot of Native Hawaiian Pacific Islander people haven't been able to access the vaccine, as well as people who still have questions and might have concerns. I don't know, Brenda, if you feel comfortable speaking to what you see in your community work.
Yeah, thank you so much, Christina. Yeah, Sela, I do understand you doing the data, for the Pacific Islanders, research scientists. But, our program is kind of like we're more directly with with the Pacific Islanders in the King County, not the whole state. But because we try to make sure that we do share the resourceful information, relevant information, and updated information to make our people, Pacific Islanders in the community, to be aware of and get the information at the same time. But we do thank you, Sela, for asking those questions, and it's also like very helpful. There's no wrong or right question, but but because all the information that we collect and keep sharing on our Pacific Islanders broadcast here, it's more like targeting the people in our King County. Yeah. Okay, thank you. I'll take this opportunity because I know that it's 6:32 right now. I would like to introduce the opportunity. Carmen Olvera is a program manager in the department, and Brenda Kalek is a healthcare navigator, and she also speaks Marshallese. I know you will be talking about a healthcare plan that is available. Can you share more about what it is and how someone would like to use it? Because we're looking for upcoming health fair sometime soon. Okay, Carmen or Brenda.
Maybe I'll go first, and Carmen will. Oops, hold on. Carmen will do all the rest. I'll take the easy one. I'll break the ice and she do all the
We
talking.
can share.
So for our health, Washington Health, it's made of three. One of them is Apple Health, which is for children, and adult, which is from 19 years old to 64. And then we also have pregnant women. And the other one is Classic Medicaid, which is for 65 years and older, also for disabled and blind client, also for people they need long-term care. Those are under Apple Health. And the rest will be Carmen to share.
So for folks that are over income for any of the Apple Health or Classic Medicaid, we have the qualified health plans, which people call QHPs under the Affordable Care Act. All these programs can be applied for through the Washington Health Plan Finder.org, which we help and navigate clients. So qualified health plans are plans that you can purchase through the Affordable Care Act that have premiums at a lower rate because you get a tax credit. As long as you file income tax and you report your income and any changes, you will get a premium at a lower cost. So those are the health plans or the Apple Health. And under Apple Health, we have 5 different health plans. We have Molina, Amerigroup, Community Health Plan at Washington, United Healthcare, and Coordinated Care. Any of those health plans, folks can choose their doctor. They can go to the clinics that accept those plans. And we assist the community in getting those benefits and knowing how to use them.
Question: who is eligible to apply, and are any documents needed? Thank you.
So we encourage everyone to apply. It's based on household size, gross monthly income. So a lot of people try to give us the net income, but we need gross. So before any deductions. And I know that's hard for some folks to understand because they're like, well, I pay rent out of that. We totally understand, but the guideline is gross income. And then depending on immigration status, we may need some documents there. And that's based on one-on-one. We rather discuss that with folks because there's so many different documents that can make someone eligible. And then we need, for everyone who has a social security number, to provide that and their date of birth and a current address. And you do not need to have a permanent address to apply for any of these programs. You can have a PO box, or we enroll a lot of folks that are homeless. So anybody can apply for that, and we really encourage it. That's what we're here to do. And once you're signed up for any of these programs, what we as navigators do is we encourage folks to find a doctor, find a clinic, and start using your insurance. Don't wait till there's an emergency to use it. We want to do preventive care, and I can go more into detail when that question comes up.
Thank you. And
I want to make one thing, Sylvia,
Sure,
because some
Brenda.
people, when they still haven't received their social security number, that always like put them step back to enroll. But we want you to enroll. There will be a time it's going to be open to provide that. But enroll.
Enrolled. I love that. Enroll. Hange koe na mo whananga mai koe ka Brenda ne ta mai kawe whotau kai ngā tonga mo whenga ke mo hu o apply ke mo ngawi a ke ngai whanga maari e koe ni a upe ka pau o ko ke tukwakai Amerikani. The next question is, under the plan, how does a person find providers for themselves and their family? Thank you.
Okay, so this is something that's really important. And again, that's one of our major roles, is to help families navigate the system. If, say, someone just enroll in Apple Health, and they've been used to going to a clinic. I always say, call that clinic, find out if they take Apple Health. If they do, then you don't have to change doctors. If they're new to the area or want to change doctors, one of the other things I really help and encourage clients to do is, for instance, if they have one of the health plans, Molina, I encourage folks to create an account on the Molina website. If they can't do it, that's why we can do face-to-face work with them. We help them set up an account, you can look up through your zip code, your address, and find a provider that's accepting current patients. And that's how we empower the clients to start learning how to look for their own providers, but we're here to help and assist. And the same with dental. We have, through King County, we have a list of dentists that take Apple Health. And one of the things that we really educate clients is when you have Apple Health and you have one of the health plans, that's for your medical. So Apple Health, Molina is for your medical. If you have Apple Health, you just say, I have Apple Health or Provider One for dental or your vision. You don't need to say, because if somebody calls up and talks to a dentist and say, hey, I have Molina, they'll say, oh, we don't take Molina. So that's another part that we try to really educate folks on is wordage when they're talking to providers.
We'll take a little pause, about like 30 seconds to please bring the Islands melody to warm everybody up. Okay, here it comes. So there is Brenda.
Favorite.
Dance. Yeah, go Brenda. Dance, dance, dance. Dance the night away. Yeah, go Brenda.
Even if I barely hear that. Why am I the only one who's dancing? Carmen says you want to learn how to hula.
Did you feel the vibes of the warm? I'm sorry, but that's our coconut music. Keep everybody thirsty.
Good.
Now you distract me. I cannot concentrate on the topic.
That's the character of an islander. My next question is, why is it important to get care even when you feel well now? Why is it important to get care even when you don't feel any symptoms?
Well, one of the things, again, one of our educational pieces is encouraging families to have preventive care. We don't want them to only use their medical when it's an emergency. The reason they have medical is so that they can set up preventive care. Once you have a home-based doctor, then we recommend you have your children have their well child checkups, their vaccinations up to date. Women get their mammograms, their PAPs, anybody over 50 to get their colonoscopies. And the same with dental. We don't want you to have a major infection before you go to the dentist. Get your yearly cleanups. Do anything preventive. So we definitely want you to, that's what the medical insurance is for, so that you can see the doctor. Of course, you know, if something happens, you need to go see the doctor because you're sick. That's what it's there for. But we want to prevent further illnesses or something major that could have been, if caught early, could have been, again, controlled or prevented. Brenda, you have anything to add on that?
I'll just give out some little example because I don't know this, but whole Pacific Islander, they're good at this. Let's say, especially diabetes is really high on our numbers. So even if you know that you have diabetes, you don't go to see your regular doctor until it's that time it's really get worse, and then they take you to emergency room. And sometimes some people will lose their, let's say, their leg because they waited on that, which it was supposed to be prevented if they had a regular doctor to go see them before that. So those are the things, it's why it's really important to just go for your regular checkup, even if you're not sick. At least if the doctor finds something little and start work on it, and instead of wait till it's too late.
Ask a question.
Sure.
And that is to Carmen and oh dear, I can only see
It's Brenda.
Brenda, thank you. And that is, could you comment on the co-payments for a doctor's visit, if whether it's preventive for preventive purposes?
With Apple Health and Classic Medicaid, there are no co-pays. So that's another thing, we provide education. There is no. Now with the qualified health plans, depending on what premiums they and what health plan, they could have the premiums, they could have co-pays, and they could have a deductible. But for Apple Health, no co-pays. Classic Medicaid, no co-pays. It covers everything.
I was wondering if you
Right.
also comment on the preventive care. Are there barriers that you encounter from your work with the community that could be preventing them from frequent visits for preventive, the follow-up visits, whether it's due to transportation, access to, means to get to these the healthcare providers?
A lot is those barriers, but the good thing about Apple Health, if somebody has no means of transportation, that is also paid for through the medical coupon, as they call it, but it's no longer a coupon, it's a card, but that can also be a benefit that can be paid for. I think a lot of it is a lot of our, especially immigrant communities that we work with, are not used to having insurance. And so they don't know, they're used to only going to the doctor when it's an emergency or they're super sick and need care. One of the things we notice is a lot of our communities use the emergency room as a home base. And that's something we're trying to really educate people by explaining to them. Let's help you find a doctor. Let's help you find a dentist, so that you don't have, the emergency room is for emergencies. We only want you to go there for real emergencies, which we explain to them what classifies as an emergency. And so, yes, the same barriers everybody sees, we see, but that's why we're here to really provide the education to the communities and try to find transportations for them, whether it's Orca Lift cards, bus tickets, HopeLink that provides transportation. So there's a lot of factors that we can help with, and that's what part of our responsibilities as navigators is to do.
Thank you, and thank you for
Thank
the important work and role that you both play in the community.
Thank you.
I think that I have my last question for you, Carmen, and also Brenda. What should a person do if they receive a letter from their state health plan but are not sure what the letter is asking for, what it means?
This is something we run into almost on a daily basis with any of the communities we work with. We say, you get a letter, don't wait till some action is taken. Call us, come see us. I have a lot of my clients, especially with COVID, when we're not doing a lot of face-to-face contact, is you get a letter, text me a copy of the letter. I will read the letter. I will decipher what is needed so that we can get moving on it. Don't ignore it. Don't leave it in the mailbox until you decide a month later to go check your mail. Check your mail regularly, open those letters. I know the language can be very frightening, but we want you to contact us, contact the navigator you're working with, and let's find out what is needed. Because sometimes people lose their benefits because they didn't submit their pay stubs, or they just didn't renew their benefits, because these benefits have to be renewed every year.
Absolutely.
So I also want to encourage all the people from Micronesia that I'm also a navigator. So if you're thinking because of language barrier, I'm there with Carmen, so we can help you with that. So try to step from the box of scared to ask
Yes.
and scared to come out and say something. Especially scared to open those envelopes. So yeah, let's do this.
So we'd like to put our contact information on the chat box, if that's okay.
Yes, absolutely. That would be great.
Brenda mentioned she or reached out to the Micronesian community. I'm wondering, are there Tongan, Samoa, and Samoan health navigators?
We're actually working, trying to get, I actually have a coworker who, from a different agency that's Samoan, and she helped me when we first started really doing outreach in the Pacific Islander Micronesian communities. And we're hoping to bring her on staff soon. So yeah, we're trying to get as many different leaders, workers from different communities so that we can really do more great work in all the communities that are out, especially in King County. We have such diverse environment, and it's amazing. And so, yeah.
Right. So I would, if I may, and be bold and put a plug up to seriously consider recruiting and training a Samoan and Tongan, other Pacific Island persons from the community as health navigators. From my own experience, I think you could benefit tremendously, because it's all about trust.
Correct.
It's understanding the nuances, the cultural nuances, and the protocols associated with how you engage with the community. But in the process, you're also building your local capacity. And
So I'm sorry.
No, so I just wanted to put a plug, if I may. I mean,
Yes.
I think the benefits would be mutual. And I say that from my own experience with investing in local community as
Yes.
interviewers, where you end up with a response rate in your survey at 80% or over
Yes.
80%. And that's because of a lot of the nuances and the trust, and that's so unique to the cultures that you would benefit tremendously.
So one of the programs that Brenda is really new to our team, but one of the programs I have talk to her about. She's only been with our team, 2 weeks, 3 weeks. But one of the programs I do with the Spanish community is I have what we call promotoras, or community health workers. They're ladies that live in the community. I have trained them. They go out in their own communities and refer clients to me. And I want to do the same with Marshallese, Chuki, some of the other communities, Crochet, and then our Samoan person that we can also have. So that's something we're working toward do is try to get some of these community health workers that are not necessarily employees, but they're reimbursed for the work that they do because they live in those communities. They know all the ins and outs of their own communities, and they in turn help us go where we may not even know where to reach some of these folks. Yeah. So yeah.
You're absolutely right, but I also think the language, because for you it would be a language barrier. They
Yes.
would be able to engage and communicate in the language.
Correct.
And that's important because a lot of the real and honest feelings and interpretation or misunderstandings can only be expressed in the language, and you can't make a direct translation into the English language.
So true. So true.
Thank you very much. And before we wrap up, this is our last song. I'd like to ask Stella, give us a one little melodious to kind of smooth iron us out, before the end of our conversation, dialogue.
Well,
But before we hop on the song, I wanted to say, maloi lele ke tau kainga tonga. Ko ngai polo kalam kono ngau tano kai mat ak mau inga opito ko talano foki ki ange ko ki modol ko ya ko ki aha mo insiwa maloi mo ilelei o kulahi ne ngai faunga pa kono mau te waki e mau fea ke whaho ke September a tavalu. Pea lai me ngai whahino hino mo tok whanongo peke polo kalamaki at me yai. And then also I'm going to ask, Brenda, please if you could just say something real quick in Marshallese and then we continue on.
Kamola lep kana mi gar ko ba do gulo yeni nim rong ja kan mele legain. Kamola Sylvian gar ka dalang yeni ni bachen narong poto mele legain. Ilo chuanien jeni dukun kajen majal. Kumamol.
Thank you so much. Okay. Here we move on to our song here.
I think it's Stella's time to dance
Katai asi eta mawai kami Kau fola Ofasi ipaea Mohenga he manatu ki maka Ula fa imata Kaina muai paea Pamahiti ko siyo taku fakanga
Okay, thank you everybody, for being a part of our Pacific Islanders broadcast and also sharing all this great and relevant information with our listeners and also everyone in the community. Our people, like one person get the information, that person will go reach out like to 10 people. And that's how the Islanders live. Thank you so much. Saria Fave Halalatu. Latu Huaka is one of our director. Also, there's a lot of them. Veni Fifita is one of our programmer. Thank you all, for participating on our program tonight. Also, Ceci and Roy Takataka. Uh, thank you. I missed some of your names in here, but I've seen that was quite a few that was joining us in the beginning. Saini Puloka. And also we have, we'd love to hear the one from New Zealand sharing us, Filippo Motulalo. He's going to join us in a few minutes. But at the same time, I would like to say thank you all for taking the time out of your busy schedule to share all this great information. And before we closing up with our King County dialogue, I just wanted to, I know that we're still working on it, but we have health fair that is about coming up. We're setting up for perhaps for September 18. That is probably the first Saturday of next month. And it will be at the Thai High School, and we're working on it. We'll have everything confirmed by this week, but it's very exciting, because it's an easy access in and out of the highway. And all the things that Carmen and Christina and Brenda were talking about, we'll have all those tent, and not only with the vaccines drive-through, but we'll have all this tent, for other services. I'll let you comment. Can you share what are the things that maybe you like to share on that day? I know that we're still working on it, but what are the things that most likely to be shared on our upcoming health fair? Thank you.
Yes, so everything is on the works and it's going perfect. So keep our fingers crossed
Yes.
that the weather cooperates too. But we're going to have all us navigators from Access and Outreach who can help enroll families in Apple Health, qualified health plans, food benefits, Orca Lift, subsidized Orca card, which is a card that folks that are on TANF, on certain disability programs can get a free Orca card for a year that they can ride any transportation in King County for free. We're also going to have a vendor that will sign people up for free phones through the wireless program. A lot of people call Obama phones. So we'll have that vendor there. We're going to have a lot of the health plans they're confirming currently. There's a couple other organizations that are going to be there. So everything is falling into place. So we hope the whole community will come out.
Absolutely. That is an exciting news, to hear. And thank you all. And now we're about like at 7:00. And I know that we're going to play one more song, so you can dance your way away. Yeah. Is there anything else, Christina, that you want to share? But I also wanted to continue on. But thank you, Stella. Do you have anything also to share? But please stay with us because we have Filippo Motlalo. He's going to share how the COVID-19 affects the government and the country of New Zealand, which is an island in the South Pacific, but it's considered to be the biggest islands in the South Seas.
I could just share one last thing before we go. We talked a lot about health and access and prevention, and just letting everybody know that the vaccine will be available at the health fair, but there's many places you can get it. And we know that there's people who have questions and concerns, but this week the Pfizer vaccine has full FDA approval. It's gone through extensive testing, over 45,000 people for over a year. And what we know is that it's the best protection against severe illness from COVID-19, that it's safe. In King County, it's free. There's a lot of options. So just encouraging everybody to get the vaccine to protect themselves, protect other people around them, and to stop the spread, including the creation of more variants.
Oh, that's wonderful. Okay, thank you. That was nice. Yeah, before we even finish, I just remember this one question. I think it's very important. A lot of the people were asking, if we have the health fair, what type of vaccine? Are we doing the vaccine from the old one, or this is the new vaccine for the Delta variant for our upcoming health fair?
So how it works is it's the same vaccine. And even when you hear about boosters, I think boosters have been in the news a lot.
Yes.
It's the same vaccine because we know that vaccine is safe and it works really well. And it's almost like a reminder to the immune system that it needs to be on the outlook for this disease and have plenty of antibodies ready. So I think a good analogy is if you were very casual at home and you never locked your front door, and then somebody was like, "Oh, I saw somebody prowling in the neighborhood, you want to be safe," you'd probably go home and lock your door. And that's like the first vaccine. But if nothing happened for a while, you might kind of get more casual again and go back to not locking the door. And then if your neighbor was broken into, that would really hit home. And that's like the second dose of the vaccine. So you'll definitely start remembering locking your door all the time and making sure your windows are closed. But if it were to be a longer time, so maybe you don't hear about anything for 6, 7, 8 months, a year, maybe you start to forget to lock your door again. And the booster is that reminder saying, no, you need to lock your door and be safe. So it's the same reminder to the body. The body now, when you have your first dose, it's made aware of this disease and what to look for and how to fight it. And the second dose and the if we do booster doses, we'll have that same effect of just reminding the body that there is a virus out there that it needs to be aware of and ready to fight off.
Take your example.
Yeah, it's very loud and clear, and it's very, very clear now that we got all the information. And thank you all. And I'm so glad that we have the opportunity to always share with the King County all the information that is very much needed with our Pacific Islanders community. Thank you all. Thank you, Christina, Carmen, and also Brenda. And looking forward to see you on this coming Friday at Thai High School campus. Setting up.
Thanks.
Also, welcome. But if you want to stay in, because we have our newscaster from the New Zealand. He's going to share what is happening right now in New Zealand. Aya ko Filippo Motulalo, ko e tahaya ko e menejaya, ko e pule letio ya. E letio ko ya 581PI, radio 581PI.com, o tuwatia every Tuesday night. Pea ko Filippo Motulalo, e nukta maifangamalia. Pag tauta maifangamalia, motokta sela panapasa. This is a blessing to, to get all these people that have the research study. Not only that, but they are working on the epidemiology and getting all the science information to help our people and others in the communities. Eko fale anka Filippo. Lele. Filippo malo lele.
Unmuted.
Iya. Malo pito wong lele mai pe. Iyo. Kata ko o tuku mange pe ko hanai ha o ngong o fe kau aki mo e whanonga te ko ia o ku o hofi lahi ko ia e he mahaki pipihi ko na nusila i he taimini. Pe ko hai ngai mea ko ia o ku hoko i he whonua. Pe ko haere mai mea nusila o ku hoko atu ki ai ki he whepaki ko ni mo e o hofi ko ia e he makpipi whakaauha ko ni a nusila. Malo, Filippo.
Ala pito pa kore ke whamalmala te ngai whatapu ko o si tala he hawhangani ka whamalmala atuai. Are we all good in tongan? Al whakatonga be whamatala koe ni Sylvia?
Iyo, sai apito, yes.
Ia malo koe o ko lotonga lockdown i o api mo whanau. Pera mo whanua katoa au mau lockdown. Koe Delta variant o e COVID-19, ko ia ni o kutoe asi i community. O kuia i hohaa, e wai e tokanga. Mahalo koe taimi koe, na e ke ima upe ia he kakai na foki mai, o ilo pe malai wakapuna pe ave pe ki nau tolu o managed isolations I ngahi wheitu upe e pureanga. Ka ke whahahoa, ko asi koe ni a Delta variant I he community, Whairewa a hoha aia ko hi hange ko ni asi pe ia I he ki toko taha. Ale toko taha ko ni ki he whatahaanga kakai na ia e toko ni mangiau. Ha toko taha me iai hu he whare lotu na whae whataha ko lotu to ia e toko ni mangiau. Wawe au pito ai mo where ia koe ni ai mahaki I aho ni ko ia e ni case e wangeau hongo fulu active I community. Ai ko toki mao hake ni ai toko no ua he aho ni. Pe au ku wawe a pito e nau whinga koe ke step mo whangatangata. Ko hi he ku natula tai mi ngao maka fu irea ia ai Delta variant. Ko e ki whatahanga lotu, ai ki kainga lotu Haamoa, hau mea e toko tahaia alu ki he no family Haamoa, hau ia ki he ako, ko e ongo apiako high school e ua I South Auckland, o mau iai, o mau wheitu ai na taki tahawhi rola, o apiako ko ia, o asi whikau kotoa ke na o sivi, ko e ko au ko maulotu I he kainga lotu katolika pa ku mix ethnicity katolika o si maa toko tahaia went to one service at 6 o'clock, but the family had been to 8 o'clock and 10 o'clock, so the whole the spreading of this Delta variant o mako whiria whatonga bea. Tai nana, tai mingao, pea whia mao ia, e maunofu mao, ko uhi kai lava o mapurei. Pea wea e slogan whaonga he pare mia, we are a team of 5 million people. Tata population o Nusilani pea mo Washington State, mo 5 million people. Ke mau ngau e whataha, pea ku osi whekao ke taitaha nofo I ono api, isolate, peko ia, one of my daughters work in the hospital as a nurse. In one of the wards, na mao e tō tahaya me ai, to e asingai me mau isolate akuia mo family o kui api. Ai ko ngahi mea ko ia, people o ku mahu inga ke whakaha ki kakai, o tau ngau e whakataha. Aki pe e te nofo mao pe koe I api, aki e te tauhi, tauhi lao ko ia, pe kapau o awe hataha ke alo whaimaha shopping me he supermarket, sanitize po koe whanwhano ko ia ni ma, whaonga e masks ke nau tui. Mui ki ngahi Agway 2 meter distancing, social distancing. Au ngahi mea koe mahu inga ke whaikai mui I he whonuani. Ko hi kai lava o mapure I ange whai mo ilo, ko hai o kune mao virus koe ni, whai mo awa ki nau tolu o huhu, peko haa whai to'o, peko isolate, o kia e toko ngo fulu whahamai, unai whare mahaki. Neongo I kai ke nau I he tonga whatu tā maki, kau whaihono siofi ki nau tolu I whare mahaki he tai min. Mahalo ko ki whanau pe ia o mea. Ko ane po he mau polokalama re tio, we spent 2 hours with church leaders. Ko hi, ko sio ke mau inga ko ia o role o kautaki lotu, I he ono organized. Tau te whito, ko atakai o Nusilani, Naomi, hange peko whaamiri, ko mātua Naomi ki heni, na opipi ki holo I ngahi whai anga lotu, o identify themselves as Tongan, identify themselves I siasi unau iai, pia whakamaunga. Ko langa e ho tau kakai e ngai whare lotu I heni ko hika na whakamaunga ki ai, Pea mokawa toi ki he lotu. Pea koe tahe ngai whaunga koe ka waha whainga message e whakao ngai. Go through the churches. Ai koe ne pō koe hoa e ua e talanoa mo e kautaki lotu. I he whainga koe ke mautu whakataha. Pea mo rea mai e kautaki lotu. Ki he ngahi siasi, ki he kāinga lotu. Ki o siwi, ka pau ku fofonu, ka pau na mao e ngahi symptoms koe ni. O tala mai, ka pau ku ange koe sense of smell, pe koe. O kia fofonu, pe koe ha. O siwi. He ukiai e ngahi whaianga siwi ke ko fotu. Kai ngata pe shopping centers, I mean, you go to your GP, your doctor, ko fotu o nia, kua e ngai drive through, ko si fotu. So drive through there or siwi. You don't have to get out the car. Now laka mai pega pau 4 people in the car. Now mai or take the swab siwi. Ko nu tala mai e te pehe mo jab was fotu something nearby here. I'm very close to the airport. E te drive through mo jab ia ke drive through be mau be ni te na to hoto hingoa mo e hafua pe o mai when I think I be ke ki hake a number of people who have had the injections go mo family mo do gon la lahi ma osi mau e penga mari ko ia ka mo ke isolate pe ke fo papa me sivi wange ko famatala ko na fa ni nai oku o fiela hiange pe te loto la hiange I lo ko o si ai pe ki pui tu o fai ki hu malu ka ko fahinga ko me ngai family ko o te ki na hu malu malo ku te mateu wange ai sino to ta haia ko ia o ka pau e a mai delta variants se we am halo ki fra no be ya o tu nga ko mo ia
To Dr. Sela Panapasa. Sela, you know, I asked this question here, and I'm not trying to against or defense or whatever. I just kind of follow the rules because here in Washington State, and I'm sure it's throughout the country, that all government employees, like counties, cities, you know, state, and if they are not going to be vaccinated, you know, all the way up till October, I think the deadline is October 18 or October 28, they will be released, you know, from their job. Aia kono ai whakatonga e tukuange nau to me ngawe. Ka kok whehu ia tu sela. O klahi pe whoki o au peko tau kai ngā tonga pana e te tukuange mai ngahi video, ange peko ngahi video, mahala me kau toke tā ko ia ai sasa awhituna nau pehe. O ku kai koe ke sai ke tokoni ai huhu o ne mau I a tau sino. I know you do the study and the research. Sela, would you be able to share your knowledge and your wisdom and what have you been studying about the vaccines, you know, and how safe or is there any side effect that will cause? Okay, Dr. Sela Panapasa. Unmute my Sela.
Thank you, Cecilia. Sorry about that.
That's
But,
okay.
if you don't mind, before I respond to your question, I would like to thank and acknowledge Filippo for his sage words of wisdom. He touched on something at the end, which is what I am employing here. And that is recognizing the influence and the power, if I may, of our churches and the church leaders.
Right.
And I am actually working and hope to pursue this project, working with our PI churches here in the U.S.
Right.
And it's multi-denominational, it's multi-ethnic, because here in the U.S., because of our small population size, I mean, we are, we are non-existent when you try and stack us up against the white population, the Latino, the Black population. But it is the churches that is where the people congregate. And so if we can invest and impart the knowledge in our leaders so that they can work and transfer that knowledge and information to the community as trusted messengers. So that's the concept that I'm working on with our church leaders, thinking of them as trusted messengers. So that they, and I believe, I mean, from both a professional and a personal position, that for our PI community on a pandemic and the extent of this COVID pandemic, this is a strategy that is both efficient, cost effective, and is going to reap huge return. So thank you, Filippo, for recognizing the important work of your radio station, and the church leaders. And I'm hoping that this whole concept is going to resonate with our PI countries across the region. But getting back to your question, getting vaccinated shouldn't be an option. It is not an option. This is a virus and a pandemic that is having devastating effects on our communities. I mean, look at the US. Over 500,000 dead. I mean, and it's climbing, it's increasing. I mean, we haven't controlled this, but more importantly, with the virus, it's going to mutate. I mean, if we don't get a handle and control it, put the lid on it, it will find a way to mutate, and that will pose challenges on our on the vaccination, because the vaccination that currently exists was designed for the original COVID virus, and now we have these new variants. So getting vaccinated, we know what we know from the scientists. I'm not a physician. I'm a social scientist, but based on the literature, based on the reports by Dr. Fauci and the National Institutes on Health and virologists, if you get vaccinated, there's no guarantee you are not completely protected from COVID. You can contract the virus even after you are vaccinated fully. The main difference is that if you do get it after you are vaccinated, you are less likely to end up in the hospital or end up on a ventilator. So right now in the US, patients who contract the virus and have not been vaccinated are more likely to end up on a ventilator and or eventually die than someone who is fully vaccinated. So if we, as frontline workers, if we would want to encourage everyone to get fully vaccinated so that we can prevent the virus from mutating and end up with these new variants of the virus. Now, the Delta variant is very contagious, and that's why, I'm monitoring the situation in Fiji. And Filippo, I know New Zealand and Australia have been providing aid to Fiji, but I am, because I'm collaborating with folks at USP, when it was reported that the first case with the Delta variant was contracted in Nandi and ended up, like you mentioned, people attended a funeral. The person had it from the hotel, ended up in the funeral, and it spread. But then people are moving over to Suva and traveling. And what is so sad right now, so what, an average of 10 people are dying a day. You're having at least 600 new cases of the Delta variant tested positive in Fiji. And the latest report, which is something I'm really worried about, is when the Delta variant ends up in the outer islands. So it's now in Kandavu, it's in Vanuatu, because there's no medical infrastructure in the outer islands. But we also know people travel to Suva, to the city, to do their shopping and take things back home, to the outer islands. So I'm sorry I went off track, but Sylvia, getting back to your question, I can't emphasize, for our Pacific people here in the U.S., the pledge to everyone is please get vaccinated. And we know from the symptoms, our PI people have very high rates of comorbidities, the diabetes, the heart disease, and hypertension. And when you have the COVID on top of that, it tends to magnify the adverse effect on our system. And so these are reasons why prevention is better than cure. So if we can, and like if I can put a plug for Tonga, for the other island countries, don't wait for the virus to arrive on your shores. You can get ahead of the virus by vaccinating your people, because the cost of care is huge. And we know our island economies cannot handle that. The burden on the families is also huge. So that is a very long, convoluted response, Sylvia. My apologies, but I'm so passionate, and I feel for our people who are dying prematurely and are dying because they're not getting the proper attention or may have the proper information. But perhaps, if I may, as a Pacific Islander, if we can draw on our sense of community, what defines us as Pacific people, and come together at a time of crisis that is devastating our people and communities. So I'll end there.
Okay.
If I can add on, Sylvia.
Yeah.
In our Ia fua lockdown goe ai haka a New Zealand ni. Na ia e whaahinga ia ka inga tonga, e whai ki tolo holo whai ki whai kawa, whai peki a ahi holo. Ko nau ilo eni te mini ku kamata ke mahino, ka ku kai te whai ki tolo holo koe a whai kawa, ku hui koe mahino koe a pipihi, ai vailasi koe ni. Pea ku apate mo wakai mai bea ku kamatain ke whai kawa i he TV. Tak tahano hope hono api o palo nei kawa tala no wai. So the Zoom is growing here. Everybody knows how to Zoom now. Ko ngai menu alukiai e whakate whito ia, how to survive. Hange ko au mo whanau, o gai whanau nau ki Iakope, o whai whetu taki mo ngahi apia ko ia pongpongi pe, ki whakalere pe a discipline ia a homau apini. Hange pe ugai pe ako a pongpongi, taftafi pe teu, I hope breakfast, osi pe ko ia, whai ki chores, mautalitari rewa, ki whai ako, ke rea mai, ki he tokotaha koe, whai na wako. Pe au ki hoa tā time lunch, pe ugai mo whanki exercise ki heke. Ka ku kamata ni ke o mai mo ngahi polo kalama, hangi o kamata ke hako anepo he mau kokama re ki o, how to survive a good mental health in living in the enclosed ai ku mau inga fangi fahino hino ko ia fangi tokoni ko ia o gai mo ai kulupu ko Christian family ko ngai fare I ko ngai hoa mari ko tau no foi be ki peitu tatau ai pe a ko to pe how to maintain peace mo sanity a family ko ia ko fagi me o ku mau ia ngai a honi ko finga I ko ke mau survive a lockdown o mau ia pe mo whakatangata koe ni o mau whi alo aki, how to manage mea toko ni, koe ku kamata ke mau lau ngai ni he mea ko te laka pinghe ku mau ki mea toko ni. Koe taimi ngā ue fuki o kwhai ngā ue mo mea. O kwhai rewa mo ki exercise au ke kaureka, ta e whasi he whiawhi, ka mau ta o lunga kātoa. O ku
when I listen to you, oku maha ko mea toka ngalai kai kakai. Oku yai o toka la o mahino ai wesi ai hotau kai ngā tatau be mo Amerikani. To lahi e whahinga ko wesi. Ka ko eke atu oku yai nai toka lahi hamo ka inga ko osi mao ko pehe ko mole na mo ui ko ngā ko maha pipi ko ni.
Ikai,
we're talking about just the topic.
Ikai, koe ki whapapau iau hani koe mahaki. O kui ai pe, mon pe glahi maungahi mea whaeiki ku hoko I lorotonga ai lockdown. Ka au ku teki ke whapapau mai ko hai o kai ki mafu hoha ake ai I think it's hard enough to e taunu pe tau tu ipe mo nofo he taimi pehe ni o kai ke ilo au ha ni ihi ilo hingoa ha ni ihi e nau os malolo inu silani ko uhi ko COVID-19
malo pito Filipo o fa pito pe ia ko mea pe maho inga ke tau ilo pe ko he ko inga ta tau pe mo American o kai ke to lahi ka inga tonga pe mo le na mo ui ka to lahi pe ai wha o tala ko we sia hona sino I mahaki ko ni.
Right.
So before we continue on, I would like to ask Seini Puloka Tatola, she's inside with us, ko ngā ko tupe o ka ane whihui, pe o ka ane mea tānaki mai. Ko ngā ko whainga mālia ko ni, we have this great opportunity. Ke tau pōtala noa pia mo Filipo Motlalo, ko radio manager ia ke PMN Tonga, Pacific Media Network. Ai rete o kai pure anga minusila. Pe pe foki kia Dr. Sela Panpasa, ko e tō taha ia taulahi ene whawhungai ai Pacific Islander Research ngai whakatotolo whasai nisi ko ia I he University ko ia o Michigan. Pe a kawat foki katoa ngai Pacific. Te tukange Seini, I o kataki o ko ilo peo kai hao whehui peo kai hao mea ke tānaki mai. Malo. Seini te katako unmute ho telefoni.
Uai mai tau katakata ka umana muha Seini
Malo opito maue. Ai whanga mari koe no tau wheha aki mo whiongo aki I he reti polkalama reti o koe ni whiawhia au pito. Whiawhia au pito mai whanga mari o ko tokoni peheni kia Silivia ki he whalere ate ai ki polkalama koe ni. Ko whenga pe whoki ke tokoni I tau kakai. Mo whakaloto lahi I ke tau whai e mea pe koe whoki o tau totonu pea ke whai. Mari au pito te tā panapasa ho pehe koe o kai ko hato option. O kai kia hao ka papite tau te ai whakarea mamawhangi he tau rea whakatonga. O I kai kia hao totonu au ke whaiteri hape koe ke tae huhu. O fu tae whakaapa e ke no fo. Ka fu tae whiunga au pito ia he koe uhi ko tau siom tau whanongo ki ngai whakamatala ai sa NEC moe tau atakai hanga tau nofo tau ngai whanua taktaha. Ai pau ko ia pe koe ke ofa koe o mea ato mao e whaitoo. Tau tupako, tau tolkoene tupaki tonga, tau whanongo ki he. Whakatutamaki ko ia o mahaki koe nanai puke ai tai 14, lahe tau ngai whamiri. Na e si imate ke isi, ko uhi ko mahaki ko ia ai ko ngahi mahaki pipihi ngahi mahaki whakaauho hanga ko taurea whatonga. So oku wai a lot of mawhana I he rea mai koe ni ai toko taha koe ni he area e whakatotolo whakasai nisi toko taha panapasa ne pehe ko ia oku futa e whakapotopoto I hataha ia ke fie wiritaki ia ne pehe e ne toton ange whaka whonuan ine tua ki koe free tomu. He koe uhi kono mere he kai whake ke ngata whangata makia pe koe mahakia koe pe. Ka koe ne toi hoko mai ana o ka apui ko toa ai anga nofo. Ia whonua ko ia o te nofo ai. Malo o pito ko fia pehe whiongo aki. Pe malo o pito tokoni mo fie kau mai ke o mai e ai mā mo pou ke tau whai ai mea pia ko o totonu. Ko mea pēnea o ko fie eke atu e au hina whehui ki he ke toke tāna mau kau. Ai anga whakoini e tau nofo whakatonga. Mo e whakoini ko tui. Ko tui whakalotu, ko tui whakaristeanei, o mahalo pahinga nau pehe o ku kai koa kon ke tau lotu ata pe. Tu pe whaito o ia pe mahalo koa ko whaito o na ko sia ngahi umea kehe tānaki ki ai. E os pe ho huhu pe ke mate koe pe te ke puke ai. Ka kai whai mea nge mua ha whakamatala toi whakamaama mai mua. Ai mea ko ngahi ake whaito o he koe kalasi hene unau futala noa I he mau nofo. Futala ai au pito ia ko whaito o ia ko mea loi pe e toki puke ia mate. Malo o pito.
Stella, did you understand that?
Mhm.
Yeah.
Oh my goodness.
This is your Tongan language day, yeah?
And you're putting me to the test. Let's say, I think I understood the question. If I can respond in English, because I think I'll contradict myself in Tongan. You know, I know that there's a lot of conspiracies. There's a lot of anti-vaccination information out there. I mean, I even receive it from some of our PI leaders, respected elders in the community. I'm part of their network, for email network, and they are sharing some of this information with me. You know, I, as a scientist, the tests, I mean, as mentioned earlier, we can celebrate the fact that the Pfizer vaccine has been approved by the U.S. Food and Drug Administration. The process to get to this, the point of a vaccine is lengthy, it's complex, and it is grounded in scientific methods of the highest standards. So I can't, I just want to emphasize the fact that the end product, which is the vaccine, is based on very robust, compelling scientific methods. And that I am aware that there are Pacific Islanders who were part of the clinical trials leading up to this full approval. So as part of this scientific method, you know, one of the criteria, a standard that we scientists are bound by, and that is ensuring that whatever is produced, the vaccine, that it does not impose in any way harm to a human being or to an individual. So the fact that millions of people have already received the vaccine and we have not seen any major or significant side effect or damage, I mean, including us. I mean, I am fully vaccinated, but as Polynesians, as Pacific Islanders here in the US, as well as in the Pacific, New Zealand and Australia, who have been vaccinated fully, and there are no side effects. What is the alternative? The alternative is death, because it's not like there's other medication, whether it's Tylenol or some cold medicine that you can take. This vaccine is designed specifically to target the the coronavirus. It is not designed for the flu or some other illness. And so this is our only solution and remedy. And the reference to our tui, if I may, whakalotu. I hope, and with all due respect, I would like to think that God gave us a brain. God blessed scientists and physicians, people with brilliance who can come up with solutions. And that includes a vaccine to help us. Otherwise, I think it would be a very sad day for God to think that he has blessed us with all these gifts and we are not, we refuse or ignore to use it to the best of our abilities to help each other. And finally, if I may, the fact that President Biden rejected having Pfizer and all the other pharmaceutical companies to patent the vaccine speaks volumes, because they're not going to be able to profit from this. And the only way as a globe, as the world, we can get a handle of this is we need to vaccinate and protect everyone. I think for the first time, the fact that here's a vaccine that is going to benefit the entire world's, 7 billion people at no profit is something that speaks volumes. And I think because eventually if the borders open and people travel, and if they're not vaccinated, then the virus can take on a new variant. But sorry, Saini, I think I may have detoured and gone a little bit philosophical.
Ika, sai au pito sela mahino. Mahino lele.
I wanted to draw on my Christian roots from the Pacific.
Yeah.
Mahino lele au pito ia. Malo au pito. Filipo kwai pe hao konga te tana ki mai ki ai. Patai me ta hange ko fok mau tol ko ni ki ange au pito. Fa ta fulu mai ka kai la lai te mai. Fie poto mo ilo hame. Ka koe ai pe ki polo kalama ko ni ko hike ke whalatola hea ko tau kāinga. He ko awia mo Silvia matui mau ko tāpua kan kon ko lau ato ke tā pangapasa. Pa tāpua kena eiki ko no ngahi ngalang ko tō pen be vai mai ki ilo he tau kausai ni si whakafo mai he whaito. Malo au pito.
Ia, malo au pito. Koe mapolo kalama ne po na telefon mai toko taha kōti ki konga me he tohi tapu. Pea nau maare ia he tāri na watu he taha pe kau pēnolo. Ko ki tohi kono ki hawa ki tohi pe taha. Ko tohi tapu ko tohi matolu. Alo lau kato e ku tau ngā aue ki he whakamo ui. Koe ko tau ngā aue ki he mati. Ko tau whinga en ki he mo ui. Pea ne mau tuku aki ia. E tuku ki wese taha koena. E koe ngā ugai e kau kai fai be whakawhepaki me whaongai ai lotu, e whakawhepaki i aki ai ngā au e whakamo ui koe ni o tau whai. Ki mua pātou ki hau koe ni o whatotola amai ki he reti o, nā ku ngā au i ta whaki koe public health ki mua pātou ki hau, ki mua i ai nau kuako whakatohi tapu i kānata. O mau katoa me ngahi ilo mo ngahi tau kei ke toko ni mai mo tatake ake tau pataha. Pea mau mātou kuai mea koe ia. Ka koe hange koe whamatala koe whai se la pa mooni. Koe ne o mai ai whamawhai, mo e iwi, mo e poto, mo e ilo, ke tau ngā ue i aki e whakamo ui ki ho tau kakai, pe tau ngā ue i mo ui ko ia. Kia te au, mo e whai ngā whakamatua tua koe ni ku ia iau he taimini, te fia i he whanau nau tūhake o lua mai ilo, mo e poto, mo e tau kei koe o ku nau mau. Pe koe seini o te keirifia he tū mai o whainasi ho ilo mo tau kei. Ko mo taimi en. Ka tuake mau ki whakamatua tūhake.
Hanga lau ka moto a te ke taimi ke tai tōla a ke kukei. Ko toki la a hopo e ke tala e koku sundown. Flipper, malo pito ka te ko lau piko whenga mali e ni this great opportunity to have Dr. Sela Panapasa. And I know we'll have more in the future because I know a lot of our people will be happy to hear because this is one of our own that we have a scientist, study and research about a lot of the health part, especially the epidemiology, Sela, I know, I think this question has been brought up over and over, and not that we're trying to bring up any issues, but it's just the human nature of asking question. Is it really true that these vaccines can be able to cause a blood clot on the human body, or it can be like 1 year from now or 2 years from now it can cause some damage? I'm just asking based on your study. I'm not saying to be accurate answer. I'm just saying because I'm tired of listening, even my own family, that I hear it, and then sometimes we kind of argue. But I just want to know if you have heard or seen some people that have been affected, with like blood clots, or they saying, 1 year or 2 years, my immune system is going to be destroyed, by these vaccines. Okay,
So,
Dr. Sela Panapasa.
Yeah, okay. So there is evidence in the literature that there have been instances or cases where there was blood clot. Well, but the point and the reality is that we are the scientists and the physicians, the medical profession, are still learning. I mean, this virus is so new, is brand new. We are learning as we go along. And yes, we won't know till further down the road what the implications of having contracted the virus is. But according to medical records, it appears that people who have contracted the virus are experiencing certain side effects, but it's happening later in the road. I mean, later on in time. That's a big question mark. What's going to happen to try and predict the effects of this virus on the human body? And again, the human body is so complicated that we will be learning. This virus and our life, I think, has changed, is going to have go through a major transformation as a result of the COVID-19 virus and its variants. So unfortunately, we still are going to have a lot to learn. But in terms of clots and all these side effects, losing one's sense of taste and smell, and there have been cases, and it is proven in the literature, but it's so small. It's tiny. The number of cases with these experiencing these major side effects is relatively very small. And it's so small, you can't generalize to represent, the population. But we have a lot to learn. And I mean, and that's something that we need to think about. I mean, because we know that the COVID is affecting all age groups, children and young adults, older adults. So imagine a child who has it, who contracts the virus at age 10, and they have their adult life to live through. And so we don't know until future work and future research what the implications or if there are any side effects later in the road. But to answer your question, it is very small. The risk is very, very small.
Thank you. Okay, I think you answered my question. Thank you so much, Dr. Selapan-Basa. I'm so glad that you did, come up, that's the safe question. Hange ko ya ka inga tonga nau eke ki he toke tā ki a Dr. Selapan-Basa. Pe e ko lahi whaki ai whakawhehu ia ko ia ai tuunga ko ia kai hu. Pe whenga ni hia o lahi a blood clots ai au whatua nau tōtō pa. Pe he o se tau taha me heni. Pe ta e ua me heni ku nau mālolo. Pe o lahi lewa ngai whawhe paki mai whehu ia. Ka kone tari hanga tonu mai e toke tā, e Dr. Selapan-Basa. O ku ia e ai pe whanki side effect ka o te ki ai ke mau hangahi mea ia o ku pehe o ku mau i e hu o tau sino. Ko e mea pe tau mua ki ai ai hu. Ko no malu i koe, pia malu i moe ātakai. Pia ko wha malola hi heni ka koe sela i he whamatala aunga moe. Ko ia te tukat peni ko ngā mau inga mua e taimina o te aha o whehu i Filippo Motlalo ka koe pule foki ia o e leti o pei tonga ai ko le te ofuka pule anga i New Zealand na whahoku fokia i he tūsite kotoa pe ai a ko Amerikani ka koe whapule lulu fokia i New Zealand pe o mau whenga e aki mo ki nau tolpa. Kai whakaamu ko e upcoming future ko e tūsite tau kolos ka tope ki New Zealand o tau lete o ka tope mea. Ko ia Filippo o ko ilo i whaka o klahi ngai mea o kumahange ko ngai mea ko mo tālanga o kia inai hao whehu i ke o ange ki he toe tā Chinese whakatotolo ko ni i he lava mau hono taimi ke tau pōta tala moia i he ahoni. Malo.
Ika ko mat ko whitāna ka pe Sela, I used to live in the Solomons for many years. And we used to take chloroquine for malaria. One of my fellow missionaries there, because it was a side effect for chloroquine, when he took chloroquine, he lost the sense, the balance. And if we don't look out for him, he would fall. Or if he had nothing to base himself upon, he can lose balance. It was a side effect, but we continued to take the chloroquine because it was good for us. Unga tala noa, koe ke pehea ku kowe whaito, ka koe pe toko taha ia mono whaunga, na ia e ki side effect, o e toko taha pehea ko ia. He ilo pe ko toko taha he toko miliona na uesia e chloroquine, balance e toko taha ia koe ni. Ka koe tala noa, oku kei whaaonga i pe chloroquine ko hiko malaria. Pako popoa pe ke tala no ko ke pai. Na hanga hani hia o pehe ku kovi pe me. Oku ia e ni i e tau tolu ko hipe ko tau whaunga. Oku ia e ka kei ke hanga ia o pehe ku kovi ai whaito o. Mako ki tāna ke tupe pe ku aonga pe kai. I don't know whether it's useful. But from a personal experience, of having taken chloroquine because of malaria, but that's malaria. Here it's COVID-19. Just because of one or two miliona ku whaongai. Katana ka tupe mo popo at peke me ko whamatala ki ai. Ko kuhange ko lau o kumahu inga ke o mai ngai popo ko ni ki tau sino ke tau lawa tau ia ki COVID-19 fumahi.
Malo. Malo pito. Ko se whatonga e whaketau taimi, ko e whitu ni maua e ni i he taimi ko e Pacific Standard Time ko ia i Seattle, Washington. Pea ko tau ofiaf mai e ni ke toi pia mini tsi mehenu tau tāpuni. Ka te o ange whanga mari ko ni ke a sela ke whai moa hane hape hane ki ako naki. It's more like what you wanted to share with the people in the community because I know that they're listening. Seini, o te ai ha mea ke whai hao ki tānak mai? Sister inside? Seini?
Koe wheko ni kia Stella Parapasa he u. Ko toka ngātu ki he evolve koe ni ai me COVID-19 e original CM maha ko whakarea pēo ko mahinoange. O alu koe no hoko ko Delta variant. Ka taki mua Stella ka kiki i whakamama mai he ta whaak whakasae nisi. Peko hae huinga mea oku riri ua ia o te hau ia i he whaunga koe no ain koe no ku ia mo ki ngoa koe. Ko Delta variant. Malo.
Hello, Sani. So we began with the original coronavirus and the variants such as Delta. I mean, because this is a virus and the virus is going to adapt to different situations. So the vaccine was designed to take care of the original coronavirus, the original coronavirus, but because, you know, not everyone got vaccinated, and it managed to mutate or take on a different form, which has become because it has adapted to the changing environments. And that's the thing about viruses. They're very smart, and they can modify or adapt to changing environments. And so this is where what has happened is that we now have the Delta variant, but the vaccine was designed for the original virus. And if we, and as you know, we now have the Gamma variant. There's a new variant, there's emerging variants of the coronavirus. And we don't have the vaccine yet to tackle the variant, the Delta and now the Gamma variant and the Lambda variant. They're all named after these take on Latin names. So there are all these emerging variants of the virus. And so the sooner we can get our communities, our people vaccinated. And now they're able to, they're calling to vaccinate the young children because they're entering school. And so we need to encourage our communities to get out and get vaccinated, because the alternative is you're going to be hospitalized and at very high risk of dying. And right now, as I mentioned earlier, in the US, the hospitals are being seeing spikes in the number of cases because of the Delta variant. And the ones in the hospitals who are getting, having to rely on the ventilator and are at very high risk of dying are the ones who have not been vaccinated. And I know in the news it was reported, we have a pregnant mother just died today with her unborn baby because of the coronavirus. And she was a nurse. And I think the reason for refusing to get vaccinated is because she thought it might have an adverse effect on the pregnancy. Well, unfortunately, she contracted the virus. She's gone, and it caused the loss of life. The reality, and I think we need to, as Sani and Sylvia, and certainly people with the work that you're doing with the radio station, there is a lot of false information, misinformation, conspiracies against vaccination. And I hope that we can, as a community, you know, mobilize and overcome that misinformation, because it's not helpful. It's not helping the community. And it would be a very sad state of affairs if we see losses where you have adult members dying, and we have orphans, children dying prematurely. So rather than, you know, I don't want to come across as being fearful, you know, or but that is the reality. And we need to be, I hope that our communities will smarten up and embrace the scientific evidence and the work of scientists, and agree to get vaccinated. And, you know, because we are all learning, you know, we have a future to learn about the progression of this virus, the impact, the side effects. But I can't imagine a 15-year-old contracting the virus today and having a future ahead of them, knowing that they have this virus in their system.
Malo opito teta panapasa. We shall overcome. All together, we shall overcome. Malo opito Filippo, pe katako na ke off mai pe hen ho mafonua ni ka na ton ke hiki mai mo family ki hen. Ke he ku ate fa malo pe o falahi ke ki mo fa to osi o fa amu pe ke faita po kina ki mo e ki mo ngai family he nga mo fai ka ko me a te mau a mana klere ki ai ko mo to kau mai I hapolo kalama I he kaha una. Tau te whita fo ke mau o kai ko mau whai ngofua ha ai tota hasai nisi ko ni o hange ko ia ko te pana pasa ai fia au pito neong o ko tokoni he polokalama whai polokalama ka fia as a listener e ta whanongo wa ko me lahi ko mari ia I he tari ko na a Filippo kau ki he ves folofola o fa to pe ves folofola ta ha ko tohi matol ke o lauia. Malo opito mo ito afat.
Malo opito.
Malo opito.
Once again, yeah, thank you so much, Filippo Motlalo. You know, it's the radio manager from the radio PMN Tonga, 581 PI, every Tuesday night here in the United States. And we are going to share the website so you can all listen in. You know, this is a great program because they have promote higher education, health education, legal advice, and everything, you know, and I always love it. So we've been partnered with them, but now we're going to dedicate, you know, to commit to have it Tuesday to connect our station directly so we can just broadcast live from here so that everybody here in the country could be able to just go so accessible so they don't have to maneuvers around, you know, looking for that. Also, Dr. Selapanapasa, deeply grateful for your time. Ko whamalo loto honga ia mo'oni. It was kind of like a blessing, you know, because that was like a message, you know, from 2006. And I found her email, and I just dropped in like a little note. All of a sudden, I got the call, and I thought, oh, I've been researching for her for over a year now. Finally, best comes at last, eh? It is such a blessing, you know, Dr. Selapanapasa, because we are so proud. We know that you're the one that collecting the data for the Pacific Islanders, and it really helps to see how our health-wise, not only with all this pandemic and also, you know, ngahi mahaki pipihi whamaman lahi, kag mahu inga whaki ki tau ilo, it helps us to see the life of the Pacific Islanders and how our lifestyle, you know, because of the way we live and also the food we take, because it reminds us, you know, food is the medicine to our body, you know. And it's so nice, you know, to hear from you, Sela, and I'm looking forward so we can have another program in the very near future. We won't let you go. We will hold on tight till you shake us off. But anyway, your time is very valuable because of the listeners, it's so different, for them to actually listen from your advice and health advice, that means more than a word can say. Whamalo mo lota honga ia foksela because ko ilo ko kau whanongo o ku iai koe lau ko pehe. The prophet is not good in its own town. Ka koe nā whanonga te ko ho lea o ka koni lahi a pito ia. Pea neongo o ku kaike nau asi mai. Ka ko hange pia koe whanonga koe re te o. Kei ki te lava ki ta ilo ata ko whakawhai group way no moe api nau whanonga kato. Pea aku mau toi live stream fok i YouTube. O toko lahi o pito ka kai unau ana toke nau TV o whanonga toi. Ka ke koe ngahi mea koe o ku ke lava share mai o hoko ia koe tapaki. It's a piece of gold to get those information and we are very lucky to have one of our own. Sister Dr. Sela Panapasa, thank you all and also thank you Filippo. Malo au pito, ai kau mai ki tau polokalama, pea koe ngata ngai e tau whamwhalarea for tonight. Thank you. We're coming to the conclusion of our broadcast tonight. Pacific Islanders podcast from Seattle, Washington.
Malo, tofatu.
Ofatu.
Thank you.